2-year-old was treated for sex cord stromal tumors, a rare type of cancer that forms in the tissues that supports the ovaries. In 2020, baby Bibian developed pain in her tummy that increased the size of her abdomen, leading to a long journey to treatment because it had secondary sexual characteristics, which had a functional ovarian tumor that produced estrogen and the male hormones. Elvis Kosgei reports on how the 2-year-old ended up with an ovarian cancer, which mostly affects adults.
Likuyani area in the county of Kakamega, we meet Faustin Andeso and her daughter Bibian Chesney basking in solitude. When baby Bibian Chesney was 9 months old, she developed pain in her tummy that increased the size of her abdomen. And just like any other ailment, her mother sought medical treatment at the nearby dispensary.
The bleeding ili last for a week. So that month, the 5th month ya mtoto akiwa 5 months ikaisha. The 6th month, tena around the same dates, tena nikaona I'm experienced the same vaginal bleeding. Kaka tena 1 week na ika stop. So the 7th month, bleeding haikukuja, but nika notice mtoto tumbo imeanza kufura.
According to Faustin, baby Bibian developed abnormal swelling in her lower abdomen, occasioned by bleeding and abnormal discharge.
Mimi nilikuwa na assume juu mtoto alizaliwa mnono na pia mimi mamake ni mnono, nikadhani amefollow my genes, mtoto ako na afya tu. But then mama kushika tumbo ya mtoto akaona hapana, inakaa imevimba. So tukaamua kumpeleka Likuyani sub-county hospital, na kufika huko pia daktari wakasema labda ni indigestion juu alikuwa haendi long call na kuli akikula anatapika.
She was later transferred to Moi Teaching and Referral Hospital for specialized treatment.
So nikakuwa na wasiwasi, nikashangaa juu mtoto alikuwa 8 months old. Nikashangaa mtoto uvimbe itapatikanaje kwa tumbo la uzazi na mtoto hata jamaliza mwaka, na wakaniambia hapa the only solution itakuwa wafanye operation surgery, watoe ile growth, alafu ndio watajua what is the problem.
After analysis, Dr. Eli Odongo discovered that Bibian was suffering from secondary sexual characteristics, which had a functional ovarian tumor. The baby underwent surgery, and it was discovered it had sex cord stromal tumors, a rare type of ovarian cancer that forms in the tissues that supports the ovaries.
Dealing with a functional ovarian tumor that is producing hormones. Estrogens, to be specific. It was producing estrogen, but it was also producing testosterone, because of, you saw she, from previous pictures, a 9-month-old had acne on the chest, acne on the face. So this is a functional ovarian tumor, and we knew that most likely we were dealing with a category known as the sex cord stromal tumor, and it turned out to be the one because our pathologist, Dr. Kaitany, looked at the slides and said, no, this is a sex cord stromal tumor. Baby
Bibian, who had stage 2 of ovarian cancer, was treated and underwent chemotherapy to suppress the malignant tumor.
Dr. Kaitany, our lead pathologist, was able to do what we call immunohistochemical staining, and we were able to determine that it was a granulosa cell, juvenile granulosa cell tumor with very good outcome. The reason why we put on chemotherapy is because it was it was stage 2 disease.
Dr. Odongo now says mothers need to be on the lookout just to establish any abnormal swelling or discharge from their children and seek medical attention.
10% of the ovarian cancers have some genetic component. I may just mention that some of them have got what we call the breast ovarian cancer syndrome, whereby those who are at risk of those who have a certain kind of genetic disorder. I may just mention it here for those who may want to know. There's what BRCA genetic mutation, which is actually inherited from both parents. It is what we call autosomal dominant inheritance. There's always a chance of inheriting it either from either parent.
Faustin now hopes to secure the future of our daughter. Elvis Kosgei, KT News, Likuyani area, Kakamega County.
Right, let's now bring in Ambassador Martin